Hi, I'm Jeremy Bludau, nurse practitioner with Cardiovascular Associates. I'm going to speak briefly about hypertension. Hypertension is known as the silent killer. We typically don't feel our blood pressure, but it is doing something to our body and it's very necessary for our body. Whenever our heart contracts, it pumps blood through the blood vessels, and that's called systole, and that is the top number of the blood pressure. When our heart relaxes, the force that's applied against our blood vessels is called diastole. So that's the diastolic blood pressure. That's the bottom number of the blood pressure. So, people always ask, what's a normal blood pressure? Well, things have changed over the years. As of right now, anything greater than 120/80 is considered elevated. Okay? Now, that's not something you might be put on medication for, but sometimes it may be depending on what your health situation is. Anything greater than 130/80 is considered hypertension. At that point, generally, people are put on medications or they're told to exercise, lose weight, whatnot. So it's good to check a blood pressure at home if you have a cuff. The arm cuffs are the best. You would put it on your left arm and you would make sure that you're sitting with your knees parallel to the ground, and you would rest for a couple of minutes, because when we move around and we do activities, our blood pressures tend to go a little higher. So you would sit with your knees parallel to the ground and you would check your blood pressure, not talking, just breathing normally, so forth. And if your blood pressures are elevated, you should let your doctor know. The issue with blood pressure being high is that we have some very, very small blood vessels in our body. You can think of your arteries of your body as like a tree. The arteries, they start big and they get smaller and smaller as they spread out through the body. The very small blood pressures are typically found in the kidneys, in the eyes, in the heart, any place in the body. They eventually get to where they're so small, they're microscopic. When the blood pressure gets too high, those vessels begin to sustain damage, and then the organ that the blood vessels are supplying, the tissue begins to get damaged. It could die without the blood, because the blood carries the oxygen and other nutrients to that tissue. So it's very important to know what your blood pressure is and to talk to your doctor about it.